Hello friends, welcome to Kavita Medicos Education. This is part first of diabetes mellitus. So here in part first we are going to see the definition of diabetes. So what is diabetes? So it's a chronic metabolic disorder. Okay, so it's a chronic disease condition. Chronic means it's a lifelong disease condition and it's a metabolic disorder of our body. Okay, so metabolic means when the metabolism of our body get disturbed, that is known as metabolic disorder. It means whatever food we are taking and we are not getting the proper energy from that food, that condition is known as metabolic disorder. Suppose if we are taking carbohydrate, proteins and fat into our diet and our body is not getting the proper energy, that condition is known as metabolic disorder. There is a disturbance in the metabolism. So how you will characterize this? So it is characterized by hyperglycemia condition. Hyper means there is a high level of, gly means there is a high level of glucose, of sugar. Emia means there is an increased level of sugar in the blood. This condition is known as hyperglycemia. So this diabetes is characterized by the hyperglycemia condition. It means there is an increased level of blood glucose. Okay, so why the person is suffering from diabetes? Due to the defection in the insulin secretion. Either this insulin is not properly secreted into our body or the secretion of insulin is completely stopped. Okay, either the insulin is secreting into a less quantity, it is not properly secreting, or there is a complete stoppage in the insulin. Next we have insulin action. It means insulin is getting secreted into our body, insulin is present into our body, but our body cell get resistance for the insulin. Okay, or the insulin is not doing its proper action. So both can be the reason. So these both can be the reason. Either the insulin hormone is not getting secreted from the beta cell of pancreas or the insulin is not doing its proper action. So both can be the reason. So understood what is diabetes? So it's a lifelong disease condition. It's a metabolic disorder of our body in which the patient suffer from hyperglycemia condition. There is an increased level of glucose and sugar in the blood of patient due to the less quantity or defection in the insulin secretion or defection in the insulin action. So both can be the reason. So what is glucose? So glucose is a vital source of energy. Whatever food we take, like for example carbohydrate, proteins and fat. Now this food get break into a smallest form. That form is known as glucose, and from this glucose we get the energy. So glucose is an important and vital source of energy for our body. And what is insulin? So insulin is a hormone which is secreted from the pancreas of from the beta cells of pancreas. So it's a hormone which is secreted from the beta cells of pancreas, and this insulin hormone is very important for our body because this insulin hormone helps the glucose to enter into the cell. So it's a very important hormone into our body. Without insulin, we will not get the energy. The role of insulin is to pick up the glucose or sugar from the blood and take this glucose into our cells and tissue. And hence in this way our body get energized. So this is a simple diagram in which I have shown from where the insulin gets secreted. So we all know that we have a pancreas which is present in the bottom of our stomach. So pancreas is a, anatomically if we will see, the pancreas is a single organ, but histopathologically and functionally this pancreas do the dual function. Sorry, how this dual function occur? Because this pancreas is the only gland which secretes the digestive enzyme that is known as exocrine role. Okay, in exocrine function it will secrete the digestive enzymes which will help in the digestion, and it will also do the role of endocrine. Endocrine means it will secrete the hormone into our body. So we are not going to study about the exocrine. Okay, we will study only the endocrine role of pancreas. So anatomically we have only one pancreas, but histopathologically and functionally our pancreas do the dual function into our body. So this region is known as the head region of pancreas, and this one is known as tail region of pancreas. So in the tail region of pancreas we have more number of islets of Langerhans. There are 1 to 2% of islets of Langerhans which are present mostly in the tail region of the pancreas. So what are these isolates of Langerhans? These are the group of cells. Okay, so here I have taken one isolate of Langerhans. So it's an island. So the scientist which discovered these cells, his name was Langerhans. So on his name he have written isolates of Langerhans. Okay, so suppose if I will take one isolate of Langerhans here, it is I have drawn in this way. Okay, so in the middle, suppose we have beta cells. So the role of beta cell is to secrete the insulin hormone into the blood, which is a very important hormone. So beta cells secrete the insulin hormone, and this alpha, this red one, are known as alpha cell. They will secrete the glycagon hormone. Okay, we will see what is the role of glycagon later on. Next, we have delta cell. So delta cell secrete the somatostatin hormone, and this delta cell secrete the somatostatin hormone. It will make a balance in between the alpha and beta cells. Now, very important, we have to understand that what is the role of insulin in diabetes. Okay, so suppose this is our bloodstream, and these green dots are known as glucose. Okay, so these are the glucose molecules which are present into our blood. Now, whenever our blood glucose level will get more, whenever our blood glucose level will reach up to its threshold pressure, which is more than 70 milligram per deciliter or equals to more than 70, okay, which is equals to 70 milligram per deciliter. And if the threshold pressure of this glucose get increased more than 70 or equals to 70, then the beta cells of pancreas will release the insulin hormone in the blood. Because these blood vessels are present all over into our body, they are also present into the isolates of Langerhans. Okay, so whenever the blood glucose level will reach up to the level of 70 or equals to 70, then only our beta cell will secrete the insulin hormone. Now, what is the role of this insulin hormone? Now, this insulin hormone will pick the glucose molecule or sugar molecule from the blood and will enter this glucose molecule into the cell for the energy production. This insulin hormone is doing the role of lock and key method. So insulin is a key for our body. Okay, there is a lock or there is a receptor into each cell of our body. So insulin is a key for those receptors. So insulin work like a key. So when this key will unlock the receptor, then only the glucose or sugar molecule will enter into the cell, and in this way our body produce the energy. So this is the important role of insulin. So here I have make a simple arrow diagram. This is glucose. Now this extra glucose which is present into our bloodstream, this extra glucose is stored into our various cells. Okay, so this extra glucose is stored in the form of glycogen by the help of insulin hormone. Okay, so the extra glucose is stored in the form of glycogen by the help of this insulin hormone. And whenever we are in empty stomach or whenever we are taking a fast, okay, then this glycogen will get converted into the glucose by the help of glycagon hormone, which is secreted by the alpha cells. Understood? So this is a reverse process. Okay, this glucose is stored in the glycogen by the insulin hormone, and this glycogen get converted into glucose by the help of glycagon hormone. Now, the process of storage of extra glucose into our muscles, into our liver, into our fat or adipose tissue, this process is known as glycogenesis. Okay, so the process of storing extra glucose into various cells of our body, that process is known as glycogenesis. So in the muscles, this glucose is stored in the form of glycogen, and whenever we do heavy exercise or whenever we do lot of physical activity, then this glycogen get converted into the glucose and we get energy. And in the liver, this glycogen will maintain the homeostasis pressure. Homeostasis means there is a balance of glucose and insulin into our blood. Okay, so in the liver, this glucose get stored in the glycogen form. Okay, and it will make the homeostasis of our blood. Okay, it will maintain the glucose quantity into our blood. Next, we have adipose tissue or fat tissue. In the fat, this glucose gets stored in the form of glycogen. So this process is known as glycogenesis. Now we have a simple, very simple diagram in which you will understand what is diabetes. So suppose if we are eating a food, okay, we are taking the food. Now, whenever we will take the food, then what will happen? In our blood, the sugar quantity or the glucose quantity will get increased. And whenever this glucose quantity is more than 70 milligram per deciliter or equals to 70 milligram per deciliter, then the beta cells of pancreas will release the insulin hormone. Okay. Now this insulin hormone will come into the blood, and this insulin hormone helps the glucose to enter into the cells. And in this way, our body gets energy. Okay. But suppose this is a normal or healthy mechanism of a healthy person. But suppose if any person is suffering from diabetes, then what will happen? Whenever he will take food, then the blood sugar will increase. And as this person is suffering from diabetes, either his body is not making the insulin or his body is making the insulin, but the cells are resistant for the insulin. Then what will happen? This glucose will remain in the blood only. And a condition will occur that is known as hyperglycemia. A condition will occur in which the sugar level will get in between 180 to 200 mg per deciliter. Okay. As person is suffering from diabetes, his pancreas are not able to produce the enough insulin, or the insulin is produced but it is in very low quantity. So what will happen? Thus, the sugar or the glucose which is present in the blood, they will remain in the blood only. Okay, and patient will suffer from hyperglycemia condition in long term of his life. Okay, so what will happen if the glucose will not enter into cell? What will happen? The cell will get starved. The cell will not able to produce the energy. Okay, even though cell is surrounded by a lot of blood vessel. Okay, and cell is having an abundant of glucose around it, but due to the deficiency of insulin, or the cells are resistant for the insulin, the glucose will not able to enter into the cell. And here, what is the irony? The cell will be starved. Okay, cell have abundant of glucose around it, but it is not able to get the glucose, and cell will go into a starvation condition, and hence that diabetic person will not produce the energy. He will have low energy in his body. This condition is known as diabetes. So how you will confirm that this person is suffering from diabetes? So there are some diagnostic criteria which we will also study later in this video, but I have written some points here, okay, by which we can confirm that yes, this person is suffering from diabetes. First, we have fasting blood sugar. Fasting means when we are empty stomach from last 8 hours. Okay, we have not taken anything from last 8 hours. That condition is known as fasting. So in fasting, the normal range should be below 100 mg per deciliter or equals to 100 mg per deciliter. And in pre-diabetic condition, pre-diabetic is a condition in which patient can have diabetes in the future if he will not do the lifestyle modification or if he will not treat his diabetes. Okay, so pre-diabetic is a condition in which that person can go into a diabetes in the future. There are chances for diabetes. So in pre-diabetes, what is the range? That is in between the 100 to 125 mg per deciliter, and in diabetes we have more than 126 mg per deciliter equals to 126. Okay. Next we have random blood sugar. Random means randomly we are doing. At any time of the day we are doing. Okay. So at any time of the day, suppose patient have taken the meal. Okay. And after 2 hours we are doing the blood sugar. Okay. In the morning, or it can be done in the evening, or it can be done in the night also. So randomly we are doing the blood sugar. So what is the criteria for diabetes? That is more than 200 mg or equals to 200 mg per deciliter. And HbA1c. HbA1c means we are collecting the average blood sugar for the last 3 months of the patient. Okay, we are collecting the average blood sugar level of the patient from the last 3 months. Okay, this is the average blood sugar which is from past last 3 months. So in the normal we have less than 5.7%, and in pre-diabetic we have 5.7 to 6.4%, and if person is suffering from diabetes, the range will be more than 6.5 or equals to 6.5%. Okay, so this was the definition of diabetes. So next we have classification for the diabetes mellitus. So according to American Health Association of Diabetes, it has been classified into 4 categories. So type 1 and type 2 diabetes are very important. So we will discuss these type of diabetes in very detail. Here I have making a short key points for easy learning and for easy understanding of types of diabetes. So first, let's discuss with the type 1 diabetes mellitus. So first point, here we have autoimmune destruction of pancreatic beta cell. Here our immune cell or our immunity will destroy our pancreatic beta cell. If our pancreatic beta cells are completely destroyed here, then what will happen? The insulin will not produced here. There will be complete stoppage of the insulin hormone. Okay. So our immunity is destroying our beta cell. By mistakenly, our antibodies are destroying our beta cell. So if beta cell will get destroyed, then there will be complete stoppage or complete stoppage of the insulin production. Okay, so it's an autoimmune disease condition, type 1 diabetes. Next, we have body does not make insulin. So if beta cells are completely destroyed here, then what will happen? The insulin hormone will be not produced in the body. Okay, there is a complete blockage or there is a complete stoppage of the insulin hormone. It mainly occurs in the young peoples or in the children and in the young adults people. Okay, so it mainly occur in the peoples who are less than 25 years of age. That's why it is called as juvenile diabetes mellitus, because it mainly occurs in the adolescent age, the people who are less than 25 years of age. That's why it is also called as juvenile type of diabetes. Next, absolute requirement of insulin as a treatment. So, the most important treatment for type 1 diabetes is complete dependence on the insulin. Patient will require the insulin for his lifelong. Okay, so patient will require the insulin as a treatment. There is no other option for the treatment of type 1 diabetes. Okay, patient have to take the insulin injection for his lifetime. So insulin is the only treatment for type 1 diabetes. That's why it is also called as insulin dependent diabetes mellitus, that is IDDM, insulin dependent diabetes mellitus, because here patient is completely dependent on the insulin. He have to take the insulin for the lifelong period. Next, we have prone to diabetic ketoacidosis. So, in type 1 diabetes, patient have a complication, that is an emergency medical complication, that is known as diabetic ketoacidosis. So, what happens in diabetic ketoacidosis? So, in diabetic ketoacidosis, more ketones bodies are formed in the patient blood. How these ketone bodies get formed? As we know that here beta cells are completely destroyed. Okay, there is a complete blockage or there is a complete stoppage of the insulin hormone. Then what will happen? The glucose which is present in our blood, it will not go into the cells, because the insulin helps the glucose to enter into the cell. As the glucose is not entering into our cells, then what will happen? Our body cell and tissue will get starved. Okay, there is a starvation condition will occur into our cells and tissue, and this signal will go into our brain. So what our brain will do? Our brain will think that our cell and tissue will require energy, so it will do the metabolism of fat and proteins in our body. Okay, now the fat and proteins will get break down into our body, and due to the metabolism of fat and protein, the ketones bodies are released, and these ketone bodies will get present into our blood, and it will leads to a ketoacidic condition of blood. Okay, so when more ketones bodies will present into our blood, then our blood will get acidic. There is a high quantity of sugar in our blood, there is a high quantity of ketone bodies into our blood, and there will be dehydration condition into our body. That condition is known as diabetic ketoacidosis condition. It's a medical emergency condition. Okay. Now, let's discuss with the causes for type 1 diabetes mellitus. So first we have autoimmune destruction. Okay, our immunity is attacking our own beta cell. Next we have idiopathic. Some causes are unknown. Okay, there is a no cause or there is a no reason for type 1 diabetes mellitus. This is idiopathic cause for type 1 diabetes due to some viral infection. Okay, if any child or any young people is suffering from viral trigger attack, then this viruses will destroy our pancreatic beta cell. Okay, so due to the trigger of uh, viruses, what will happen? Our pancreatic beta cell will get destroyed. So for example, we have some viruses, that is Coxsackie virus, rubella virus and mumps virus. Next we have family history. So type 1 diabetes runs in the families. Okay, it's a hereditary disease condition. If your grandparents or parent is suffering from type 1 diabetes, then there are chances that the upcoming generation or the next generation will suffer from type 1 diabetes. So it's a family inherited disease condition. Next, let's discuss with the pathophysiology. Okay, how this disease occur into our body. So due to the genetic, okay, due to the genetic factor and due to the environmental trigger factor, like the viruses, okay, due to the autoimmune destruction of beta cells, what will happen? The autoimmune destruction of beta cell. Due to all these factors, our beta cell will get completely destroyed. Now, when beta cells will get completely destroyed, then there will be decreased insulin production. Okay, and as insulin is less into our blood, so what will happen? The glucose will not able to enter into the cell and glucose will increase into our blood. This condition is known as hyperglycemia condition, when the glucose or sugar quantity is more into our blood. This condition is known as increased blood glucose level. Okay. Now, as the cells are starved here, okay, glucose is not entering into our cell and tissue, due to which less energy will produced here. Okay, less form of ATP energy will produced here, and our body will think that our cell and tissue are starved. Okay, due to which our body will start do the breakdown of fat and proteins. Okay, now this fat breakdown will lead to a ketone formation into our blood, and our blood will get acidic. That condition is known as diabetic ketoacidosis. Diabetic ketoacidosis condition is only present in type 1 diabetes. Okay, and just remember one thing, out of 10 people, only one will suffer from type 1 diabetes mellitus. Okay, type 1 diabetes mellitus occur only in 10% of people. Okay, out of 100, it occurs only in 10% of people, and out of 10, it will rarely occur only in one person. Okay, so it's a rare form of diabetes. Only 10% people are suffered from type 1 diabetes mellitus. Okay, and here we have an emergency medical condition, that is diabetic ketoacidosis. Just remember all these points. It's very simple. In type 1 diabetes, it's the autoimmune destruction of beta cell. As beta cells are completely destroyed here, so insulin will get stop here. Okay, and patient will have a hyperglycemia condition, and the only treatment for type 1 diabetes is to take the insulin injection for his lifelong period. Okay, so it's an autoimmune destruction of beta cells. Okay, only 10 people suffer from type 1 diabetes. Let's discuss with the type 2 diabetes mellitus. Okay, it is very important type of diabetes. So it mainly occurs in 90 to 95% of people. It's the most common type of diabetes. So what happens in type 2 diabetes mellitus? Here, our body cell and tissue get resistance for the insulin. Okay, and there is a insulin deficiency. Okay, our cell and tissue are completely get resistance for the insulin, as insulin is a key for the glucose entrance. But due to some lifestyle factor or due to some lifestyle condition, what is happening? Our cell and tissue get resistance for the insulin. Here insulin is get produced into our body. Okay, there is an insulin production into our body, but that insulin is not sufficient for the glucose. Okay, So it's a most common type of diabetes which occurs in 90 to 95% of peoples. Next we have this type of diabetes is called as maturity onset of diabetes. It means it occurs in the older age peoples. Okay, the people who are more than 40 years of age or 45 years of age. That's why it is called as maturity onset of diabetes. It's a gradual and chronic diabetic condition. Next, we have called as non-insulin dependent diabetes mellitus. Here, patient is not completely dependent on the insulin. Okay, he can also treat his diabetes by changing his lifestyle or by taking the diabetic drugs. That's why it is called as non-insulin. It means patient is not dependent on the insulin. Okay, so it is called as non-insulin dependent diabetes mellitus. That is NIDDM. Okay. So what are the causes for type 2 diabetes? So people who are obese or they have obesity in their body. So what will happen when we have overweight, then our more cell and tissue are produced into our body. Okay, mainly we are talking about the abdominal fat. If we are having more abdominal fat, then we come into the category of obese. Okay. Next, we have sedentary lifestyle. If we are following a same routine and sedentary lifestyle, if we are not doing any physical activity or we are physically inactive into our life, then this type 2 diabetes can occur. Next, there are chances of family history also and due to some genetic factor also. Genetic factor and family history is also responsible for type 2 diabetes. Next, we have older age. As I have told you that it's a maturity onset of diabetes. It means it will occur in the people who are more than 40 years of age. So it's a maturity onset of diabetes and who have high triglyceride levels in their body, which is more than 250 mg per deciliter. And the women who are suffering from PCOS. PCOS is polycystic ovary syndrome. So what happens in PCOS? In PCOS, the woman body will produce the androgen hormones. So androgen hormone is mainly a male hormone. So in this condition also, she can also suffer from type 2 diabetes. Okay. So due to the production of androgen hormone, she will have less or irregular ovulation process. So the women who are suffering from PCOS, that is polycystic ovary syndrome, they're also more prone to type 2 diabetes. Now let's discuss with the pathophysiology of type 2. So what is happening due to the obesity and due to the overweight and due to the lifestyle factor, our fat, liver and muscle cell will become insulin resistant. Insulin resistance means they are not allowing the insulin to come and enter into the cell. Okay. Insulin is a key for the glucose. Okay. So due to the obesity and lifestyle factor, our fat cell, our liver cell and our muscle cell will become resistance for the insulin. Okay. Little amount of insulin can enter into the cell, but more amount of insulin will remain into the blood only. Okay. So due to which what will happen? The glucose will increase into our blood and patient will have a hyperglycemia condition, a condition in which glucose level remains in between 180 to 200 mg per deciliter. Here I am writing that is condition known as hyperglycemia. Okay. As insulin is not going into the cell, so glucose will remain into the bloodstream only and patient will have a high blood glucose level, that is hyperglycemia. The glucose level which is in between 180 to 200 mg per deciliter is known as hyperglycemia. And in starting, what will happen? As I've told you that if insulin will remain present into our blood, then what will happen? Our pancreatic beta cell will produce more and more insulin. Okay. If this threshold is more than 70 mg per dl, okay, if glucose is present into our blood, okay, and it is more than 70 mg per deciliter, then our pancreatic cell will release the insulin hormone. In this condition, there is a hyperglycemia condition. So in starting phase of diabetes, what our beta cell will do? Our beta cell will produce more and more insulin. Okay. As there is a more glucose into our blood, so our beta cell will increase the amount of insulin into our blood. So in starting phase of diabetes, patient will have a hyperinsulinemia condition. It means insulin will increase into our blood. Okay. So it's the early stage, which we also called as pre-diabetic stage. But when this insulin, our beta cell will produce more and more insulin and it will do its work in a very extreme way. Then what will happen? They will get tired. Our beta cell will get tired. And slowly, what will happen? Our pancreas get weak due to the overproduction of insulin. And after some years, our pancreas will get weak and they will decrease the production of insulin. Okay, and hence patient will have a persistent high blood sugar level, that is known as type 2 diabetes. So next we have gestational type of diabetes. Gestational means it's a pregnancy induced diabetes. So it is detected during the pregnancy period only. So this type of diabetes will occur when the woman is get pregnant. So this type of diabetes will occur when the woman will get pregnant. Okay. So it occurs in the second and third trimester. So one trimester is formed from the 3 months. So first starting 3 months is known as first trimester. Then after that 3 months we have 4th, 5th and 6th month, that is known as second trimester, and the last 3 months is known as third trimester. So this gestational type of diabetes will occur in the second and third trimester of the pregnancy. Next we have, due to the pregnancy hormones, body cell get resistance to insulin. So what actually happens in the pregnancy? So in pregnancy, a female body produces a lots of hormones, and these hormones are required for the protection of the baby. But in some females, these hormones will do the cell resistance for the insulin. So this pregnancy hormone will do the resistance for the insulin. Okay, these pregnancy hormone will do the resistance for the insulin in the female body. So mainly what happens in the pregnancy, when female will eat more and more food, then this sugar quantity or the glucose will enter to the baby by the placenta. But here the insulin will not enter into the baby. Okay, placenta will not allow the insulin to enter into the baby. Okay, placenta will not allow the insulin, mother insulin, to enter into the baby. Only the sugar which is present in the mother blood, it will enter into the baby, due to which baby will be in a large condition. So here female have a macrosomia baby. Okay, she will deliver the baby who have weight more than 4 kg. That condition is known as macrosomia condition. And this female will return into her normal condition after the delivery. Okay, when she will deliver the baby, then she will return into her normal condition. Okay, but there are chances that she will suffer from type 2 diabetes in the future. Next, there are other form of diabetes which I have written. They are called as secondary type of diabetes or rare form of diabetes. First, let's discuss with the MODI. So what is MODI? MODI is maturity onset diabetes of young. Okay, just listen one thing. Here, this diabetes is occurring in the young peoples. I have written here MODI. What is the full form of MODI? Maturity onset diabetes of young. It means this type of diabetes is occurring in the young peoples who are less than 25 years of age. But this type of diabetes will occur slowly. Okay, it's a gradual onset of diabetes. Basically, what happens in the MODI type of diabetes? There is a mutation in a single gene. Okay, so it's a single gene mutation process, and this single gene will do the less insulin production and the less insulin production from the beta cell. Okay, just remember, MODI is a condition which will occur in the people who are less than 25 years of age, and here the patient will have a single mutation in a gene. Okay, and this gene will do the destruction. This gene will do less secretion of insulin into the patient body. Okay, it's a gradual process. It's not a sudden process. It's a gradual process. So here patient will develop the diabetes gradually. Okay, and it's a type of diabetes which will get inherited into the future generation also. So it's a inheritance type of diabetes. If any parent, mother or father is suffering from MODI diabetes, then there are 50% chances that their child will suffer from MODI type of diabetes. Okay, here the insulin is produced in a very less quantity, or insulin secretion will be stopped here. Okay, less insulin is produced here. That condition is known as MODY. Next condition we have, that is LADA. Okay, actually LADA is also known as 1.5 diabetes. Why it is known as 1.5 diabetes? Because this LADA condition comes in between type 1 and type 2 diabetes. Okay, it will come in between the type 1 and type 2 diabetes, in between type 1 and type 2 diabetes. Okay, here I have a low space in the board. That's why I have written LADA here. Okay, so it is known as 1.5 diabetes. The full form of LADA is latent autoimmune diabetes in adults. Okay, so it's a diabetes of adults. Okay, and in this condition, what is happening? Our beta cell is destroying our own immunity, or our own antibodies is destroying our beta cell, which condition is also occurring in type 1 diabetes. That's why it is known as 1.5 diabetes. Okay, this will occur in the adult people who are more than 40 years of age, and here our immunity will destroy our beta cell, so there will be complete stoppage of the insulin. That's why it is known as 1.5 diabetes. This condition comes in between type 1 and type 2 diabetes. Next type of diabetes, which are known as secondary type of diabetes, I have written. First we have exocrine pancreasis diseases. The diabetes which occur due to the exocrine destruction of pancreas. Exocrine pancreas have two parts. First we have exocrine part, and next we have endocrine part. We all know that exocrine part release the digestive enzymes. Okay, and endocrine part release the hormones into our body. So if there is a disease of exocrine part, then the beta cell will get destroyed here completely. Like we have diseases of pancreas, like we have pancreatitis. It can be acute pancreatitis condition, or it can also be chronic pancreatitis condition. Itis means inflammation of pancreas. Okay, so if any person is suffering from acute pancreatitis or chronic pancreatitis, and if any person is having a pancreatic cancer, or if there is a complete removal of the pancreas from the body, then insulin will not produce here, and patient will go into a diabetic condition. That is known as exocrine pancreasis diabetes. Next type of diabetes, secondary diabetes, we have drug and chemical induced diabetes. So due to some drugs and due to some chemicals, any person can go into a diabetic condition. So it's a rare form of diabetes. Okay. For example, we have drugs like glucocorticoids, thiazides, and antipsychotic drugs. So these drugs will increase the stress level in the patient body. And when the stress will increase into our body, then automatically what will happen? The insulin production will get decreased. Okay, the insulin secretion will get decreased into the body. And also, these drug will trigger the immunity. These chemicals and drug will also trigger our immune system. And our immune system will attack to our beta cells. And also, there will be complete or slow production of insulin. Next, we have infection. If we are coming into the contact of infection or into the contact of microorganisms like bacteria and viruses. For example, some viruses I have written here, that is cytomegalovirus. Next we have Coxsackie B virus and congenital viruses. So what actually infection is doing into our body? One thing. First, infection can destroy our beta cell, first point. Okay. Next, what infection can do? What microorganisms can do into our body? Microorganisms can also trigger our autoimmune system, due to which the antibodies are released, and this antibody will destroy the beta cell. And third, due to the infection, our blood sugar level will rise. Okay, because this infection will increase the stress level into the patient body, and due to the more stress, more glucose will produce into our body. Okay, so these are some factors. So here we have discussed about the classification of diabetes mellitus.